If you are avoiding pelvic exams, you are not alone. People avoid going to the gynecologist or getting health checkups, especially if they involve getting a physical exam, for many reasons. But avoiding the screening that happens at these exams can be detrimental to your health. Watch this video to learn some tips on how to advocate for your care so you can get the pelvic exam, but on your terms. I'm Dr. Lora Shahine. I'm a double board certified reproductive endocrinologist and OBGYN, helping people with their overall health and well-being for almost 20 years. As a woman and as a fertility patient myself, I have been on both sides of the exam table a lot. Through my own experiences and helping my own patients, I have learned some tips how to advocate for the care that you need, because I do see people avoiding health checkups or even avoiding coming to see a fertility doctor, no matter how much they want to be a parent, because they're scared about the pelvic exam. I appreciate how uncomfortable and awkward and nerve-wracking this exam can be for the patients. And I want to share with you some incredible tips to help you get the pelvic exam on your terms. I recently did an Instagram collaboration with Dr. Heather Arubunda, where we went through the same tips that I'm going to share here. The response to this collaboration was overwhelming. This really touched on a pain point for so many people. It was shared over and over and over again. And the messages that I got in my DMs that week when I shared this were just amazing. Thank you so much. I shared this with my friends. I shared this with my mom, who's scared about going to the gynecologist. I'm really happy to be able to share this with you here today. In this video, we're going to review exactly what a pelvic exam entails. Number two, we're going to go over why it is common to avoid pelvic exams, like why people would want to do that. And number three, we're going to go over 5 key tips to help you with your next pelvic exam. So for the pelvic exam, you can expect to go into an exam room. Typically, you talk to the doctor first, where they go over history, any symptoms that you're having, any questions that you have. And then typically they go out of the room and you change into a gown and take off your underwear. So you are undressed from the waist down. And then when the doctor comes back in, or it could be a nurse practitioner, your healthcare provider, sometimes we'll do a breast exam at the same time. They might do an abdominal exam, and then they would have you rest your feet in stirrups and lie down. So they're able to look at the outside of your pelvis, and then they could use the speculum that is placed in the vagina, open gently so they can see the inside of the vagina, and the cervix, which is the bottom part of the uterus that you can see with a speculum. They might remove the speculum, and then they might do the bimanual exam, where they're just feeling on the outside as well as the inside, your uterus, your ovaries, etc. They're feeling for any abnormalities, like irregularly shaped uterus could be a sign of fibroids, just these benign tumors that can sometimes be on the uterus and cause heavy bleeding or pain with periods. For the ovaries, normal ovaries, you often can't feel on a pelvic exam, but if someone has an ovarian cyst, sometimes that can be felt. So that's the typical exam, and there could be parts of it that are included for you and parts that aren't included for you. This is what could happen at your pelvic exam. So why do people want to avoid pelvic exams? I mean, don't people want to be healthy and get the screening? I mean, certainly a pap smear will screen for cervical cancer and dramatically decrease the chances that you develop cervical cancer. But pap smears can be awkward. They can be nerve-wracking for people. And what I've seen, either with friends or family or in my own practice, sometimes people avoid pelvic exams for many different reasons. They could have had a negative experience with a pelvic exam in the past. The practitioner could have not really explained what was happening. It could have felt uncomfortable, maybe even a little painful. And of course, somebody doesn't want to repeat a negative experience. Other people have had a history of sexual assault or sexual trauma, and thinking about doing a physical exam with the pelvis can be very triggering and upsetting for people. Other people just say it feels awkward and, I've done it in the past and everything's been fine, so why do I have to do it again? Sometimes people assume that they don't need pelvic exams if they have never had intercourse. And that's actually not true. You can talk to your doctor about your sexual history and whether or not it's right for you to have a pelvic exam or not. But if you're having symptoms, it might really be helpful to have an examination to see why you're having pain or change in discharge or all sorts of things that can be evaluated with a pelvic exam. So if you are avoiding pelvic exams for any of these reasons or a different reason that I didn't mention, you are not alone. It is okay to be nervous and feel that way, but I want to give you these 5 tips to help you advocate for the care that you deserve. Tip number 1, you do not have to have a physical exam at your gynecology visit or your health checkup. You can talk to your doctor. You can review symptoms. You can talk about your sexual health. You can talk about your overall health and well-being. You can do a lot of education and learning. There's so much that goes into a health checkup. It's not just about the physical exam. Now, if your doctor recommends it for whatever reason, you can take that recommendation. You can say, thank you so much. I'm going to schedule that at a later date when you've had a little bit more time to prepare and do it on your terms. Number 2, you are allowed to choose the doctor or the practitioner that does your pelvic exam. It's okay to ask for a female nurse practitioner or a female doctor if that is right for you. It's okay to ask for a certain doctor that you have a good rapport for. And you know what? If you show up that day and that person is not in the office and doesn't feel right for you to proceed with someone that you weren't planning on, reschedule. Number 3, you can ask for a chaperone. This is another adult in the room when you have your physical exam. Now, if you want to bring a partner or someone that you know and trust to be in the room, make sure you call the clinic beforehand, because every clinic has its own policies and that may be okay and that may not be okay. But even if you can't bring a partner or someone that you want to come with you, maybe they're not available that day, you can still ask for a chaperone at the physical exam. It can be someone that works in the clinic, a medical assistant or a nurse who can kind of just be in the room with you. And it doesn't have to be just the provider doing the exam and you can have somebody else in the room. Number 4, you can ask the doctor or the provider to explain exactly what they're doing and when they're doing it. So I've had pelvic exams and I know what it's like to be lying there and just kind of like your feet are up in the stirrups and you're sort of like, what is going on down there? Ask for information. Just say, hey, I am nervous about this physical exam. I know it's important for my health, but what's really going to help me is if you tell me exactly what you're doing. Like, tell me before you touch me, tell me before you place the speculum. Just really communicate with me exactly what you're doing and let me communicate with you. I might ask you to slow down a little bit. I might ask you to stop and kind of wait for a second so I can do some deep breaths. Talk to the person that's doing the exam before they get started about what is going to be helpful for you. Tip number 5, you can stop the physical exam anytime. This is your body. This is your appointment and you are in charge. So if anything feels off, hurts, anxiety, whatever it is, you can just say, please stop. I thought I was ready to do this today. Today is not my day and I'm going to reschedule. You can stop for any reason. And that is so important to realize. So let's recap. Pelvic exams can be really helpful for your overall health and well-being. You can screen for certain cancers like cervical cancers. You can evaluate certain symptoms. You can screen for sexually transmitted diseases. There's lots of reasons that pelvic exams can be beneficial, but it's also okay to be nervous about them, feel awkward about them, and just avoid them, quite honestly. And so what I'm hoping is by watching this and learning these 5 tips, you have found ways to get the pelvic exam that can keep you healthy, but on your terms. I hope you learned something today. I think this is a wonderful video to share with anyone that you know that might be feeling nervous about a pelvic exam or has expressed to you that they're avoiding going to see the gynecologist because they're nervous. This is an empowering video. It's got a lot of wonderful information that puts the patient in control of their own body. And that is so important. There's such a power dynamic between the doctor and the patient, but we have to remember that the doctor, nurse practitioner, the healthcare provider is there to help us and help us be healthy. And so we need to communicate when we're feeling vulnerable or we need more communication, and you are in control of that appointment. Like this video if you learned something, comment with questions that you have. Be sure and subscribe to this channel so you get my weekly video, and stick around for more learning.